pandemic in King County is improving. It's been improving since January 10th, when we saw the peak of the Omicron surge. The number of hospitalizations has fallen by about 2/3 since that time, and the number of cases have also fallen significantly since that time. Our hospitals are in better shape now. Our vaccination rates in the county are very good. So almost 90% of all adults have completed their first 2 doses of their vaccination series. And about 80% of everyone in the county is vaccinated right now. Although we've seen great progress, we still have a lot of COVID-19 circulating in the community. The rate of COVID-19 among Latin Americans in King County is among the highest, is about twice what it is for white King County residents, and it's also higher than it is for Blacks. Latin Americans make up about 10% of the population of King County. Yeah, and 16% of COVID-19 cases. And Asian Americans make up 16% of the cases, but they make up 19% of the population. And Black King County residents make up 7% of the population and 9% of the COVID-19 cases. Whereas white King County residents make up about 58% of the population and 43% of the cases. For hospitalization, the rate for Latin American King County residents is approximately 4 times what it is for white King County residents.
Wow.
And it's also higher than it is for Black King County residents. It's the 3rd highest rate after Native Hawaiian, Pacific Islander, and American Indian Alaska Natives. And then if we look at deaths, which is obviously the most serious outcome, the same relationship holds. It's Latin American King County residents have almost 3 times the rate of death as white King County residents. Unfortunately, is something that has been seen across the United States. And I would say the problem is present in King County, but to a lesser degree than it is in many other communities, but it's still a problem here. And there are a number of reasons why people speculate about why this might be the case. People who are in different racial and ethnic groups, don't have equitable access to healthcare or resources, more risk for becoming infected in the first place, either because more people work in the essential worker workforce that requires more community exposure and risk for COVID, or have more high-risk occupations, whether or not people have the resources to isolate and quarantine, in the home, or test rapidly when they become infected. The size of the household has been something that people have wondered about. The other thing to consider as a possible explanation is some of our Latin American community members have a higher rate of underlying medical conditions like diabetes and overweight and maybe smoking and other things that put them at high risk for serious COVID and hospitalization. We have, in our country, a problem with systemic racism, whereby some people, like people of color, including Latin Americans, don't have the same access to educational opportunities, don't have the same economic benefits, don't have the same access to healthcare, don't get treated the same way in the healthcare system, and might not feel as comfortable seeking healthcare. Problems that were in place prior to COVID and persist. And in combination with the COVID epidemic, they exacerbated the underlying problems and really brought them again into focus. We do really need to do better. We really need to do better with the booster dose. That long COVID is definitely something that people should try and avoid. Long COVID is basically a chronic illness that develops even after mild infections. and it can cause breathing problems, heart problems, can cause neurological problems, thinking and concentration, and it can take your energy away and can make it very difficult to work or do the things that people want to do.